Hi, I'm Dr. Karam. I'm a board-certified facial plastic surgeon, and I'm going to take you through how I perform an upper blepharoplasty. An upper blepharoplasty is the technique where we remove excess of skin on the upper eyelids, and I'm going to take you through step-by-step how that procedure is performed in order to not only help you understand the procedure, but also to hopefully reassure you that this procedure can be done safely and naturally, and I'll explain some of these tips and tricks that I use to determine that. Now, before we get started, please take a moment to like this video as well as subscribe to my channel so I can bring more of this content directly to you and we can help get this out to as many people as possible. All right, so what is upper blepharoplasty and what is it used for? So there's a number of indications, but primarily it's because a person has either genetic or aging-related excess skin on the upper eyelids. And that can manifest in heaviness and drooping of that region. And many people notice a change in the shape. For women, a lot of times they notice that they are not wearing their makeup the same way, as they don't have as much eyelid platform to put eyeshadow on, etc. So what I do to remove this and leave the person looking completely natural, there's a couple basic points here. Number one, the incision is always made in the natural eyelid crease. And the eyelid crease is where the eyelid folds when the eyes are open. And everyone has a natural eyelid crease. And so I make that incision in the preoperative setting with a person in the sitting position, mark that portion of the incision. I determine with a small caliper how much extra skin that they have that they don't need in order for them to be able to safely close their eyes. And in this video clip, you can see here, that's the segment of excess skin that's going to be removed. The lower portion of the incision line, the marking line, is where the natural crease is. The upper segment is how much extra skin can be removed. So once this is done, then the next step is the removal of that extra skin. And in the way I perform it, I only remove excess skin. I don't remove the underlying muscle, and I don't remove excess fat. These are two things that can make the eyelids look different and sometimes impair the ability for the eyelid to close properly. So the key pieces to keep it looking natural are, number one, place the incision in the natural crease. Two, don't remove excess skin beyond what you don't need for eye closure. And then three, don't move any other types of anatomy such as skin, such as muscle and deep fat, which can actually age the eye and impair eye function. So once that segment has been removed safely, then the final step is simply closing the incision. And we do this with very fine surgical sutures, and we remove the sutures in about 4 days. And once this is removed, as you can see in these before and afters here, the eyelid looks completely natural looking. There's no sign of surgery. And more importantly, if you look carefully, there is no change in the shape or nature of the eye. The essence of the eye has remained the same. It's just the aging-related skin excess has been removed. And that is to put together a very simple and safe way to perform eyelid surgery. And I've been doing this for 15 years in thousands of cases, and patients absolutely love the fact that it remains unoperated and natural looking. I hope this helped you understand the procedure. And if you have any questions at all, please feel free to jot them down here in the comment section. You can also check out my website at www.drkaram.com, and my Instagram at Dr. Karam has loads of information that I think you'll find there as well. Thanks so much. Hope you enjoyed it.